Warm welcome to everybody here. Let me first begin by congratulating all of you for prioritizing your eyes, for taking this effort to be aware about this condition called as glaucoma. So, the World Glaucoma Week is conducted every year in the month of March with the express goal of creating awareness about glaucoma. So, the intention is to generate information about glaucoma and share it with the public so they become aware of this condition, because glaucoma is a chronic eye disease. It is a disease which doesn't present with any pain, and it is a disease which causes damage to your vision in an irreversible way. So this webinar is my endeavor to create awareness about glaucoma. So let's dive into the details. Just let's give a minute for a few more people to join. Meanwhile, if you all have any queries related to the topic, or anything at all that you want to speak of, just make a note of it. We'll have 10 to 15 minutes at the end. I'll be able to take your questions, and any doubts that you have, we can handle it later. I'll share my screen. So I think my screen is visible to everyone. All right. Okay, so let's begin with knowing about this term glaucoma. Here, okay. So what exactly is this term glaucoma? This is the name of the disease that affects the optic nerve. Now, the optic nerve is like a cable that connects your eye to the brain. Let's take an analogy of this camera. The images in this camera has to be transmitted to this computer, and that happens through this cable here. Similarly, in our eye, whatever information or whatever images that we see is transmitted to the brain through this cable or the optic nerve. This optic nerve comprises of millions of nerve fibers. All right. Just So what exactly So what goes wrong in eye to result in glaucoma? So let's look at this picture. It's a schematic representation of the eye, and I'll use simple terminologies without using any medical jargons so that it becomes easy for us to understand what glaucoma is. Within the eye is a hollow structure, all right? So within the eye, there is fluid which is continuously being produced in this particular area. And from this area, this fluid comes to the front part of the eye. Now, the purpose of this fluid is to nourish the tissues in the eye. As it is produced from one part, it also needs to exit from the eye. And this exit of fluid happens through a 360-degree channel, which is in the peripheral area of the eye. Now, in this 360-degree channel, there is a sieve-like structure through which the fluid is passed out. If there is any clogging of this sieve-like structure, or if there is any mechanical obstruction for this fluid to reach this sieve-like structure, both these scenarios will result in one thing, which is the fluid will remain in your eye, and gradually, because of which the eye pressure will start increasing. And at some point, when the eye pressure goes beyond a particular limit, it starts pressing on your optic nerve, and that's when glaucoma starts to appear. Now, this picture is that of a normal optic nerve. This is how a normal optic nerve looks like. Whereas the picture below is a representation, or is just a picture of an eye with an advanced glaucoma. Now, see the difference in how it looks like? This one looks like healthy red, pink in color, whereas the one below is pale and thinned out. Now, when the pressure constantly keeps pressing on this optic nerve, it gradually changes from this to this. Now that we know that what is glaucoma and what goes wrong in the eye that results in glaucoma, it's important to first find out what are the risk factors for developing glaucoma. So the most important risk factor is the high pressure in the eye, followed by advancing age. So when we say advancing age, anybody above the age of 40, and more specifically above the age of 60, the incidence of glaucoma dramatically increases. Besides these two factors, family history of glaucoma in itself is a risk factor for developing glaucoma. So the published literature tells us that if we have a first degree relative who has glaucoma, there is a 5 to 10%, 5 to 10 times risk of developing glaucoma in the next progeny. For example, blood relatives like brothers, parents, or children. The other risk factor is certain ethnicity or race. So blacks and Asians are more susceptible to develop glaucoma. So the incidence of glaucoma is more so in these races, and this is considered as one of the risk factors. Besides these four important risk factors, the other contributory cause could be unsupervised long-term use of steroids in any form. You may be using steroids for any other condition, for treatment for any other systemic problems such as asthma or any other autoimmune diseases. It could be in the form of a skin cream, it could be in the form of a tablet, it could be in the form of an injection. When these steroids are used for a long duration and without any supervision, it can result in increasing eye pressure. If you have a history of injury to the eye, which could be injury in any form, whether it's a punch to the eye or an injury from a ball or a penetrating injury, these injuries can distort the exit channel. Remember, we spoke about the exit channel through which the fluid goes out of the eye. So in these injuries, this exit channel can get damaged, and that's how it can result in glaucoma later in future. Besides these six factors that we discussed, the other risk factors that can contribute to develop glaucoma is people with a very high minus number, also known as myopes, or people with very high plus number, also known as hypermetropes. There is another entity called as low tension glaucoma, wherein the eye pressure remains within the normal range, but they still develop glaucoma. This particular type of glaucoma is known as low tension glaucoma, and the contributing factors towards developing this glaucoma is systemic vascular diseases. When I say vascular diseases, I refer to disease that affect the blood vessels, which is blood pressure and diabetes and any other cardiac diseases. So having these systemic diseases also can become a risk factor to specifically develop a condition called as low tension glaucoma. So this slide sums up the risk factors for developing glaucoma. Let's now move on to the symptoms of glaucoma. So it's very important to keep in mind that in the early stages, there is barely any symptom. There is no pain. You will not have your central vision affected in any way for you to seek help. So when there is no symptom like pain to alert, the disease quietly progresses, resulting in advanced glaucoma, and that is why it is called the silent thief of eyesight. So in the very early stages, when there are no symptoms, it is difficult for the patient by themselves to come for help or come for checkup. But in advanced stages, what will happen, or that's when the patient will start experiencing the symptoms. And what is the nature of this symptom is that in glaucoma, the central vision is always going to be intact. And most of our work, which is reading or driving or daily routine moving from one place to another, it's the central vision which matters. We never look at or we never assess our side vision. And when side vision is affected in the early stage, it never comes to our attention unless it becomes like a tunnel vision. In advanced glaucoma, it results in what is known as a tunnel vision, wherein, let's say, a person with advanced glaucoma is driving. If there is any car or any vehicle which is coming from the side, the person with advanced glaucoma will not be able to perceive it. So, this is the nature of glaucoma, and this is how glaucoma affects, wherein your side vision is affected. And the important thing to remember is that whatever side vision is affected because of glaucoma is permanently affected, meaning it cannot be recovered back. Some of the vague symptoms that could be there is blurry or patchy spots in the field of vision. There could be some difficulty in seeing in dim light. When the pressure is very high, let's say pressure is above 40 and 50, the front portion of the eye becomes little swollen. And that's why when you look at the light in the nighttime, especially, it seems like there's some colored halos around it. Some patients may perceive dull eye pain or a vague headache. So these symptoms are very non-specific in the early stages. This is a particular slide which I have used to highlight how a tunnel vision would be. So on the left side here is a patient where the vision is normal and all this picture is visible to this patient. Whereas in this eye, who has advanced glaucoma, the side vision is affected. So see the difference between the two? And when it further progresses, it becomes like a tunnel vision wherein only the central vision is maintained. But this is seen in advanced glaucoma. At this point, identifying glaucoma is not a challenge. Treating is not a challenge. But then the challenge is whatever vision is lost because it was not identified before cannot be recovered. So now that we know about the risk factors and the symptoms of glaucoma, how is it that we diagnose glaucoma? What exactly happens when a patient steps into the clinic? The key to diagnose glaucoma is to ensure that there is a comprehensive eye checkup. Now, what do I mean by a comprehensive eye checkup? A comprehensive eye checkup must include your vision checkup, it must include your eye pressure check, and it must include a dilated examination of your eye. Okay, so these three components form a part of your eye checkup, and this is what we call as a comprehensive eye checkup. In most of the clinics, when you go for an eye checkup, there will be an initial workup which is done by a qualified optometrist or by the doctor themselves. So basically, in this initial evaluation, we ask details like your family history. So herein, what do we want to know? We want to know if we have a family history of glaucoma or other eye conditions which are known to be genetic in nature. So here we are assessing your risk factor. Number two, we ask about your systemic condition. Like if you're taking medications for blood pressure, we want to know if you're taking medications for diabetes. So here we are ruling out your systemic risk factors. We also ask about your current medical history. Are you taking any drops currently? Are you taking any steroids? We also ask about history of injury in the past. So when we take this detailed history, we are at the back of our mind eliminating or looking for these risk factors. And as all these evaluation is done in this manner, we are definitely able to identify whether you have glaucoma or not. So this is what happens in a comprehensive eye checkup. Let's go to the next slide, which talks about what are the tests for glaucoma. So what happens in a comprehensive eye checkup is a general evaluation. And in that evaluation, if you have any risk factors related to glaucoma, we do further tests to diagnose or confirm glaucoma. So these are 5 to 6 investigations which we do depending on your eye condition. In this, we check your eye pressure, not with the air puff. Most of you, when you go for an eye checkup, you may be familiar with the checkup where there's a click of a button and there's a puff of air on your eyes. What we are doing there is to check your eye pressure. Now, that is a screening method. And if in that evaluation, your eye pressure readings are on a higher side, we always want to validate it and recheck your eye pressure by this method known as a Goldman's applanation tonometer, wherein we instill some numbing drops in your eyes. And with the help of this instrument here, which is blue, with the help of a blue light, it comes in contact with your eyes and we validate your eye pressure. Now, this is a gold standard, and this is the way in which your eye pressure is checked in a ideal condition without any false readings. The other thing that we do is we want to know the exit passage in your eyes. We want to know whether the angles in your eye from where the fluid exits, whether it is clogged or whether it is obstructed. And this is done by this gonioscopy evaluation, which again is a simple OPD procedure where we put numbing drops in your eyes, and with the help of a special lens, we want to see the angles in your eye. The other checkup that we do is we put the drops in your eyes to dilate your eye. So let's say this is a model of the eye, and this is the front portion of the eye, right? So this part is called as the iris, and we want to evaluate the inside portion of the eye here. So this is the optic nerve and this is the retina. In order for us to evaluate it in a comprehensive way without any ambiguity, it is important that this area is dilated, and with the help of special lenses, we are able to visually evaluate your optic nerve, and this is known as ophthalmoscopy. The two main investigations that we do for glaucoma testing is the one where we check for your visual field. Remember, glaucoma is a condition which affects your side vision. It does not affect your central vision. So we want to know if your side vision is affected or not. And this test here, which is known as a visual field analyzer, helps us evaluate it. So this is a demanding test, and this is a test wherein you have to do this for at least about 10 minutes. Each eye is evaluated and the visual field for each eye is charted out. And this test gives us an important, valuable information about the functional affection of your visual field. This is a special scan, also known as a OCT scan. And what this test does is, it literally gives us the anatomical evaluation of this optic nerve. So each layer in this optic nerve is evaluated at at the cellular level, so that the first layer which is affected with glaucoma as well is identified. And basically your baseline structural evaluation is done with this test. So structural evaluation and functional evaluation are the two most important investigations that we do as a part of your glaucoma evaluation. So these are simple tests, and whenever you have your eye checkup, if you do need these investigations, your doctor will explain to them the logic and the reason behind doing them. So now we know what are the tests for glaucoma, and let's know about treatment of glaucoma. So the treatment of glaucoma is very simple, and the goal of treatment is very simple, which is to reduce the eye pressure in the eye. This can easily be achieved with the help of topical drops, anti-glaucoma medications, and there are some laser procedures as well, which will help us reduce your eye pressure. When the eye pressure is not controlled by these conventional methods, and if the optic nerve continues to get affected because of this increasing pressure, in that case, you may require a surgical intervention. Now, there are many types of surgeries that are available to ensure that your eye pressure remains less, and each of these surgeries have a specific goal, and they are individualized depending on your lifestyle and what your target eye pressure is. And this will be explained to you by your doctor. But the important thing to remember and important treatment criteria is that once the glaucoma is established and once we know that you do have glaucoma, our endeavor is to ensure that there is no further damage in your eyes, so that whatever evaluation at this point has been done, that forms like a baseline evaluation for you. So let's address this question. This is something that comes very naturally, isn't it? We all like, I've been a patient too. So if I come across a diagnosis like glaucoma, I want to know, can it be prevented? I would be worried for my children since I know that it is a genetic condition. I want to know, can it be prevented? So the answer to this question is glaucoma can be identified, but it cannot be prevented, right? But any further damage can definitely be stopped or stalled by initiating the treatment. So it's very important to understand that the treatment of glaucoma is available. It's available, but it needs to be started at the right time so that we don't reach into the advanced stage. And that way, we will not reach to the level of blindness that is usually associated with glaucoma if it is missed or if it is not identified. The other ways in which it can be prevented is to protect your eyes from injury. So remember, we spoke about how injury is also one of the risk factors for developing glaucoma. So for people who are in certain professions where they are prone to injury, it's important to wear a protective gear and and if you have sustained any injury, to ensure that you have a proper evaluation. So at the end of the day, glaucoma cannot be prevented, but awareness about glaucoma itself is a very valuable weapon that we have to ensure that you have treatment at the right time. So knowing your risks definitely helps to prevent glaucoma. Now, the next thing that we need to address is how frequently should we have this comprehensive eye checkup? Now, a comprehensive eye checkup is the most important tool to catch glaucoma early. So adults at the age of 40 should definitely have a complete eye checkup done at least at some point, because this is when the early signs of glaucoma sets in. And if you have any risk factors during this evaluation, either in the form of high pressure, or if you have a family history of glaucoma, or if you've had an injury to the eye in the past, depending on the evaluation findings, your eye doctor may recommend more frequent examination. So if all this evaluation turns out to be normal for you, you can have a checkup once in 2 or 3 years, as long as till the age of 40. After the age of 60, we recommend having a comprehensive eye checkup every year. Because glaucoma, one of the important risk factors of glaucoma is advancing age. So we have now understood what glaucoma is, what are the risk factors. We know it can be treated, but we know it should be intervened at an early stage. Now that you know all this information, if I have to ask you all, what is my role in creating awareness about glaucoma? I would think in these terms. First, let's help ourselves. Let's ask ourselves, when was the last time I had a comprehensive eye checkup done for myself? Do I have any risk factors? Now I know the risk factors for glaucoma. Do I have any of these risk factors that is applicable to me? If yes, please have a comprehensive eye checkup. Because remember, glaucoma may not have any symptoms in the early stage. It is a painless chronic eye disease, just like other conditions like blood pressure, diabetes, and cholesterol. So you have an opportunity to help yourself by being aware of glaucoma, and you can share this same awareness to your friends and near and dear ones, because at the end of the day, our goal is not to keep this information to ourselves. We want public to know that glaucoma can, even though it cannot be prevented, it is definitely treatable. It is treatable only when we know our risk factors, only when we know that these are the things that are involved in eye checkup. So with that, we end the webinar. In a sense, the presentation, which talks about awareness of glaucoma. I hope I did not use any medical jargons to confuse you all. If I did, apologies for that. But I hope everybody is clear about what is glaucoma and what are the risk factors involved in it. So when we sent out the Google form, we had also asked our invitees to share any questions. So there are few questions, interesting questions that I have received. If any one of you have any questions to get clarified, please feel free to do it. We have about 10 to 15 minutes to address your queries. You can use the chat box if you wish to write in your queries. Meanwhile, I have two or three questions. So one of the invitees had asked, what steps?
Hello, hi. Sorry, doctor. Did you ask something? Not able.
Hello, ma'am. This is Neelima.
Yes. Hi,
Yeah.
Nilima.
So, hi. I have a family history of glaucoma. My father had it. I just want to know, is there any pranayama or any breathing exercises that should be avoided? I am diabetic too, and I'm close to 50. So, or
Okay.
any yoga asanas so that I can delay or to avoid this particular.
All right.
Yeah.
Nilima, you raised a very valid and relevant question. So, pranayama is basically a breathing technique. All right. So, that is not going to affect or have any impact on your glaucoma. But there are certain specific postures in yoga, especially Shirsasan, wherein upside down procedure, I mean, not exercises, where in Shirsasan, wherein the head is down and your torso is up. So these are the exercises which are to be avoided. Otherwise, yoga is a very good form of exercise to maintain the flexibility in your joints. It has all the benefits. So the only exercise you need to avoid is Shirsasan. Why? When you're doing Shirsasan, all the blood, because of gravity, is inside your brain, correct? In the eye area. So during that moment, when you're doing Shirsasan, you are subjecting your eye to a higher pressure. So for eyes which already have glaucoma, during the process when you're doing this Shirsasan, you're subjecting your eye to extra pressure. So it's not like you're going to suddenly the effect of Shirsasana is going to be obvious immediately. But if you're not aware of this and if you continue to practice Shirsasana, maybe over a period of 1 or 2 years, your glaucoma will progress. So, as a thumb rule, as a protocol, we inform all our established glaucoma patients to avoid doing this particular yoga asanas. However, all other forms of exercises are encouraged. In fact, all the recent literature encourages mild to moderate aerobic activity and has known to reduce your eye pressure. I hope I answered your question, Nilima. Right. So there was an interesting question from the list, which said, can glaucoma affect children? So, glaucoma per se is a disease of old age, like after the age of 40, but we do have congenital glaucoma also. In fact, congenital glaucoma is an entity where the child may be born with glaucoma. So, this also is a part of the family history, and anybody who has a history of congenital glaucoma is more susceptible to have the first degree relatives of this particular person is more susceptible to develop glaucoma. So let's say in the family, somebody who is 40 years old and he has been diagnosed to have glaucoma and has been initiated treatment for glaucoma, our advice to them is this, that please inform your family members, your blood relatives, like the brothers, sisters, their parents, as well as their children, to have a comprehensive eye checkup done. Why? Because again, this person falls in the category of having the risk factor because of family history. So again, though this patient is being treated for glaucoma, when we pass on this information that since there is a risk factor in the family, please get yourself evaluated. The other people in the family who may or may not have glaucoma will never know about it. So having a checkup this way ensures that we are able to catch glaucoma even if it is in the early stage. So another question is about, can glaucoma be reversed? So this is a person who wants to know that my eye has been identified to have glaucoma and my doctor says that my side vision is affected. What do you mean by side vision and can it be recovered? All right. So basically, like we mentioned, in glaucoma, it is the side vision which is affected, right? And once we establish the diagnosis of glaucoma, we do this baseline evaluation, which is the visual field evaluation, to document and identify how much that side vision is lost. So at that point, whatever side vision is already lost cannot be recovered. But in the subsequent follow-up, once the treatment is initiated, our endeavor is to understand that, is to ensure that further damage doesn't happen. So to answer in brief, whatever vision is lost, whatever side vision is lost because of glaucoma cannot be recovered. But further damage can definitely be prevented by treatment and to ensure timely intervention. Because for instance, all right. So this question is regarding use of steroids for a particular eye condition. So yes, steroids are our friends. It can also become our foe. But it is important to ensure that your eye pressures are side by side checked as well. So if your eyes need to be on steroid medications for whatever reason, for the primary problem that you have, in the subsequent visits, whenever you have your eye checkup, your eye pressure also needs to be checked. It does not mean that you should stay away from steroids. These steroids are required for the treatment of your primary eye condition. It is only a possibility that steroids can result in increased eye pressure. So the solution here is not to stop the steroids. The solution here is to ensure that you do not develop high pressure because of the steroids. So in every subsequent visit, whenever you go back to your treating physician, they will definitely check your eye pressures. Why? Because they know that you're on steroids and this is one of the risk factors. Suppose your pressure is higher than normal, and if it is identified that it is because of the steroids, there are two things that the doctor may do. One is they will start you on medications to control the eye pressure, but we will not ask you to stop the steroids, okay, because that is giving you some benefit. And the second option is if your vision is, if the pressure is very high because of steroids, then there are alternatives that can be tried, which is without dependency on steroids. So such decisions are taken uh, depending on the primary eye condition that you have and by deciding the pros and cons. But at any point, if your eye pressure is on the higher side, while you're on steroids, the glaucoma medications, topical medications are initiated. And once the primary eye condition has subsided and once the steroids are withdrawn, your glaucoma medications in a timely way can also be withdrawn. But all this needs to be supervised. Supervised meaning you need to have a regular eye checkup where eye pressure is monitored. Can we do Ayurvedic treatment for eye like Tarpanam or Tiladhara if you are prone to such conditions, if it can affect the eye pressure? So as of now, our medical data tells us that such Ayurvedic treatment have no impact on eye pressure. I'm not sure about the benefits of these conditions, but if they don't cause any harm for your eye, you can proceed with it. But we're not aware of these treatments that will specifically help you to reduce the eye pressure. Can people who have normal age-related vision and require reading glasses, can such people use orthokeratology lens? Yeah, orthokeratology is a totally different topic altogether. We can deal with it at some future point. We can have a webinar on myopia. So I believe I have addressed most of the questions. And anyway, the intention behind this is to create awareness about glaucoma. I would like to convey a disclaimer that whatever information that we have shared is only for educational purpose. Please do not interpret what has been discussed in it as a treatment that you're already undergoing. The doctor to whom you're going for treatment is the one who is familiar with your eye history. I am merely sharing information as to what is required for our general awareness of glaucoma. Do not do not stop your treatment randomly at the after knowing about these facts. Please discuss these things with your doctor. There could be other primary conditions that you may be having. Your doctor to whom you're getting the treatment from will be in the best position to address your queries. What generally happens with steroid drops is that we generally have this tendency of, we initiate some drops which is required for the eye. We will keep it somewhere, in the fridge or somewhere at home. And maybe after 4-6 weeks, when you have the same problem, we may start using the same drops. So this is what we mean by unsupervised use of steroid drops. So any eye condition that you have can present in only 3 ways, isn't it? You may have redness, you may have pain, and you may have watering. So it needs to be deciphered to decide upon what exactly you have, and then the medications are prescribed for you. So the point I'm trying to make is the idea behind this webinar is only for awareness. Any further questions that you may have pertaining to the treatment that you're already undergoing, ensure that you ask them to your treating eye doctor. Is there a risk post LASIK? So LASIK as such does not increase your risk of glaucoma, okay? But prior to planning for a LASIK surgery, your eye needs to be evaluated in a comprehensive way in terms of vision, eye pressure, and also how your optic nerve is. So prior to planning for your LASIK, if you do have advanced glaucoma changes, let's say, it is very important for us to make a note of your baseline eye pressure. And what happens in LASIK is that some part of the cornea or the front part of the eye is removed, right? So basically the cornea becomes thinner, and this has an impact on the way in which we measure the eye pressure. And that's something which your doctor would want to know. So if you've had a history of LASIK, please inform this to your eye doctor, because then the way that eye pressure is measured for you also changes. I don't see any more questions. So I would like to clarify on this particular aspect. So whenever we check the eye pressure, generally we say a pressure of 11 to 21 is well within the normal range. But there are people who have pressure of up to 24, but is normal for their eye. Why? Because there's a very important entity we check along with your eye pressure. We also check the thickness of your eye, which is known as a pachymetry or the corneal thickness. So to put it in a nutshell, if your eye is like a football, the walls are very thick, and if your eye is like a balloon where the wall is very thin, the way the eye pressure is within these two structures is quite different. So for a football which has a thick wall, the pressure is going to be on the higher side. So the optic nerve in that eye is well protected because of this thick wall. Whereas for the eye, which is like a thin balloon, even a slight increase in eye pressure will be directly transmitted to the optic nerve in that eye. So just giving you a rough example as to why the history of LASIK matters to us. So if you have had a LASIK and your eye pressure that we measure is compared with the thickness of the eye that you have, it forms one of the parameters against which we evaluate your risk factors. But having LASIK as such is not a risk factor for you to develop glaucoma. So the risk of developing glaucoma after LASIK is similar to risk that is applicable to any other person without having LASIK. So I urge you all to share whatever information that you have received in any which way with your family members, especially who is above the age of 40 and 60. There are still so many people who have never had a single eye checkup done, even at the age of 50. So our endeavor is not to look for a disease in the eye, but at least to have a comprehensive eye checkup, which will pick up anything in your eye from front to back. When your eye is evaluated, all these problems will be picked up, and more specifically, glaucoma. So I think it's time to conclude our session. Thank you so much for being part of this webinar, and thank you so much for wanting to know and be part of this awareness campaign. So there are many ways in which this Glaucoma Week is celebrated around the world. There are certain camps which are being conducted, and in certain clinics, there are certain days which is dedicated for evaluation of glaucoma. This is one endeavor I thought we can reach out to people, given the current scenario here in Dubai. But online medium is quite a powerful medium. Do share it with your friends. And at the end of this webinar, I'll share the ebook, which is a small complimentary gift from my side as a part of glaucoma awareness. The content of all this, of whatever I've spoken, is from the standardized textbooks and broken up in simple way so that this can be conveyed to you. Thank you so much. The free ebook will be emailed to you. And basically, it'll have a gist of what all we discussed here. All right. Take care. Bye-bye. Have a great weekend.